Good afternoon or good morning, everyone, and I want to welcome all the participants and the colleague to this day two. And I want just to briefly introduce some issue that we are going to see in this day two. Especially, I want to underline the multidisciplinarity that has characterized all the presentation that you can see today and you have seen yesterday. I want to focus especially in our environment here in Brescia. You know that this Expo Symposium, and I have to thank you very much, Mount Sinai, Bob Wright, and all the colleagues in the USA to connect to us for this important event. Well, Brescia is a highly industrialized province in the upper part of Italy, really next to Milan. And we have some peculiarity that could drive this kind of study in omics, particularly, and our experience and expertise could improve the group to study exposome. Brescia is highly industrialized, but is in some recent statistics is the first province in Europe for percentage of value added in the industry and for number of persons employed in industry. Our expertise is the metallurgic. Beginning from the Grace period, we were able to work metals, and now we are leading for automotive, surface treatment, robotics, weapon. You can see Beretta, for example, that is known everywhere. And we have also other kind of industry like Acquedulci, that is a sturgeon farm selling caviar to Russia. So Brescia is known for these kind of production for industries. And here, an Occupational Institute in Brescia, founded 2 decades ago, 3 decades ago, studied and deep, especially metallic elements, like speciation, reproductive and developmental toxicity, reference value. And now we are going towards metallomics. Unfortunately, this high industrialization drive Brescia in a very recent publication among the first, maybe the first city in Europe for PM 2.5 pollution that can high very much the premature mortality. And we were able to publish, it will be published soon in environmental research, our results on the role of PM 2.5 and PM 10 in the in increase COVID incidence rate and in increase total all-cause mortality in our region and in our province. You know that in the first wave of COVID pandemic, Lombardy, especially Brescia, Bergamo, and some other provinces were leading the infections in Europe. But I don't want to frighten you, because I know that you want to enjoy the city, and you can enjoy here nature, food, culture. You can enjoy also art, and our university really is really proud to host another edition of the Exposome Symposium, hopefully in person in 2022. If someone was in our previous edition, I hope appreciate the location, and I'm sure that in the next one we will be better than the previous one. Thank you. Thank you, Megan.
Donatella, you can move right into your next presentation.
Thank you. Yes, I'm the first speaker, so I have this advantage to to move forwards towards my presentation. So, as Megan told you, I'm an occupational physician, and today I want to present you how we are facing the omics sciences. Well, I will present you that we are not so expert in omics sciences in our field, but it could be really challenging to introduce more deeply into the work studies the omics science and the exposome. Why we need to consider work in studying exposome? You know that work could deeply influence health and well-being, and you know that among the sustainable goals that WHO introduced, like goals in the next in the next years, the eighth one is about decent work and economic growth. But also the presence of work, like the employment, and also the capability to join the economic growth in a sustainable way. So we have to face two postulates. The work is crucial to health, and disease could be crucial, and the effect of work could manifest in typical disease or in more common disease, such as cancers, musculoskeletal, respiratory, cardiovascular, or psychiatric and psychosomatic disorders. So the challenge is to stop or to control the negative effect and to push, to enhance the positive effects of work. I want to acknowledge a recent publication of our study group that modelize through models that could take not only the work part, but also what is influencing the environment outside the working issues. And this work, this kind of modeling, could enhance the policy makers to not only study but also manage the health impact of work activity and also the indirect impact on health of this activity. As an occupational physician, I was more used to this kind of exposure disease scheme that put together the occupation and the environment like a parallel way, and could start from exposure to the disease or toxicity, and could mark some steps that we have to be able to assess and to surveil and to prevent health problem. You know, we are going to calculate the rate, the amount of the work dangerous effect in the lifespan. In some ways, sometimes we can use the daily measures, and sometimes we can use the attributable factor to some risk factor. For example, this recent work from Netherlands measure which is the percentage that we could attribute to some work risk factor, some occupational risk factor, and for some disease, in particular musculoskeletal disease, mental disease, dermal, auditive, and respiratory. We could export these results also in all the rest of the nations in Europe and in most developed countries. What we mean for occupational disease? You know that if we want to define the occupational disease, we need to refer to the system of recognition and compensation. And so this needs a clear evidence that work is the cause of the disease or can contribute significantly to its development. So we want to diagnose occupational disease, but these are later on prevention. We need to prevent occupational disease. So the past decades of prevention in the occupational fields basically based the direction on these exposure-response relationships. So we were able to measure these relationships for chemical risk, for ergonomic issues, for also allergic chemicals, or in general, if we are able to draw this curve, we are able also to identify some limits, some level of exposure that could be safe or even no effective. But the next, the work environment of today present us some other challenges. For example, we are not facing only the occupational disease, but we have to face also the disability that sometimes affect the workers and that we have to manage in the workplace. So I want to present you this very useful classification of the disability that we could use to correctly fit for work the people. Another challenge for us is the mental health. You know that mental health issues are increasing worldwide, and the prevalence estimate is 40% in Europe in the lifespan, and yearly a big amount of the workforce could face such a problem. And this is an increasing theme that connect work with stress, particularly work-related stress, but also work with psychiatric disorders, or we can manage also substance abuse in work during the work, in the workforce and during the working period. Manage not only means that we want to say that this abuse could increase, maybe yes, could increase, but also we could have a good chance in the workplace to make some education and to lower this. Another theme interesting and increasing in these days is aging. You know that a few years ago, there was a really big campaign from in Europe to face this problem during the work and in the workforce. And mainly in other globally, not especially in the developed country, we have also the problem of the younger workers that globally could represent also more than 50% of the labor workforce. And they could be susceptible, more susceptible than adults. And we need to think on this kind of such an age issue. Another interesting increasing challenge for us in the workplace are the high promotion. We already know that we need to move to maintain our health and our well-being. And it's really interesting to notice that coming from the previous to the recent one statistic in Europe, a new risk factor was introduced in 2019, that is the prolonged sitting. Prolonged sitting is a new occupational risk factor that we have to face in the next years, and is with all the other classical risk factor that we could see also in the previous table from Netherlands, and that cause the percentage of fraction attributable to workplace. About the future trends, I have to mention also the increasing of use of new chemical elements in the production, and this could represent a really challenge also to study the effect of these new elements and the combination of the mixture of elements together in new production. And what about Industry 4.0? You know that we are leading the Industry 4.0, but we have to think on the really big difference that are facing the emerging countries in this new challenge in this area of new industrialization. And this new industrialization drive also some other issues like smart working, some needs of new digital capabilities for the workforce, the issue of privacy or the use of social media for health promotion, and the so-called techno stress that we are really facing also in this period of lockdown. So what about exposome? I seeked in the literature what some colleagues have written on this theme and in occupational setting. And I found particularly interesting 3 of these publications that I want to briefly present you. The first is this one, is a network-based approach for characterizing occupational health problems, mainly oriented to the chemical exposure. But I think this is a very interesting approach, is entailing with big data, and as the author writes, they want to provide and develop expertise on the disease exposure relationship by using this network database, and for developing surveillance of occupational health problem, and for detection of emerging association between diseases and occupational disease. And I want to show how they propose to face this theme of the drive in the network to face the occupational health problem in an exposomic way. And so they want to study the real complexity of the relationship between disease and the very composite, wide occupational exposure, and try to seek similarities. And for example, they present the example of the exposome of the lymphomas non-Hodgkin. And you can see that through the mining of this database, they were able to represent in this quite complicated way all the substances that appear to be associated with this type of cancer. And sorry if I pass rapidly to the last one for this paper. They present their results in a more comprehensible table, and they conclude that this approach constitutes a decisive step towards the evolving monitoring of multi-exposure associated to a given disease. I think this approach could be really promising, even if from this publication I cannot find out many other examples on this. So how many, which could be the drivers and obstacles to adopt, for example, toxicogenomics for chemical risk assessment? This is my second chosen paper focus, and this group from Canada analyze some insights that derive from social sciences. And sorry, I want to highlight the conclusion. And so they conclude that the researcher developing newer and more elaborate omics methods need to consider the capability to work with workflows and simplicity of use, lest they afford better adoption of their innovation and fail to impact the practice. And I want to underline what they summarize in this table. And I want to underline some drivers, for example, the superior scientific understanding, for example, the reduced animal use, the international collaboration and harmonization, that is what we are doing now, and some obstacles, for example, the insufficient validation, the complexity of interpretation, the difficulty of coordination, the high level of investment, the lack of organizational support. We need a national organizational support, the lack of expertise, the lack of standardization. And the last choice from the literature, I want to conclude with an Italian paper. In the omics science, the big data are a crucial issues, and big data analysis offer us some really interesting chances in prevention. For example, big data are characterized by volume, variety, veracity, velocity, and value. And these could be a particular theme, a particular issues when we could drive some issue in occupational medicine, such the use of sensors, of smart devices, augmentation of reality, special for education. This is my last, so I hope to remain in my minutes. We need prevention. Prevention, especially in the occupational field, is derived from policy. And these are my proposal main themes for the policy analysis in the omics science. So we need prioritization, commitment, resourcing. We need the multidisciplinary collaboration. We need to understand which are our stakeholders. We need to have a planning, also to prioritize the resource. We need to adopt a wider perspective and to provide continuity. And this could enhance the promoting the preventive approach through the omics sciences. Thank you.